What would you say are the unmet needs in access related to MPN care, specifically as it relates to clinical trials, and what can we do to address those unmet needs?
Well, I think there is a problem with rare diseases in terms of geographical access to trials. And we often find patients have to travel a long way. I know that's true in North America as well as in Europe. And we're very lucky in our geographical locations, but in some parts of the world, some companies do not open clinical trials. So I think there's an access issue. I think also there's something about patients have to meet rigid entry criteria for clinical trials. And so, oftentimes in myelofibrosis, for example, commonly patients who failed ruxolitinib have a lower platelet count, and that's often an exclusion criteria. So those criteria are there to try to get a uniform population of patients in a trial, but it can feel like you're excluded as a patient, and it can feel very tough for your healthcare team that we can't include you in a clinical trial. But we also have to remember that it's there for safety purposes. So if there's a lower limit for platelet count, that's often because the drug might affect platelet count. So it's really important that we have a broad spectrum of trials available and that we try to increase the availability of trials for patients. But I also want to say a word about inequality of access and thinking about accessing some different ethnicity. So often non-white patients are underrepresented in clinical trials. And I know that's a focus in the UK and also in North America as well. And it is really important that patients have access to a clinical trial if they need it. And also that we understand how investigational products will work in people of different backgrounds. For example, we know that probably, Nicole, your blood count, assuming it's a healthy, normal blood count, may well be different to mine for background racial genetic differences. So drug metabolism might be different. So this is really important, and we need to work hard as a community, the clinical community and the patient community, to raise awareness and improve access for patients.
Well, as someone who does a lot of work in health equity, Dr. Harrison, I really appreciate you pointing that out. It's certainly an issue here in the United States. As you mentioned, differential access to clinical trials. And we've learned that not only are patients often not aware, but often the providers, at least here in the US, are not offering clinical trials as an option for patients from marginalized and minoritized communities. So I really appreciate you bringing that up.